things. One is this is going to be, like she said, very interactive. I have slides, but if we don't get through all the slides, then it's okay, because I want to talk about what you want to talk about. Couple of things. One is Laura and I were in the restroom one day, a ladies' room, and
dude, that was almost wine through my nose.
But not at the same. I mean, we were you know, I've never seen all gender restrooms like I have here. I'm a little confused by that. Because in Wisconsin we still have men's room and women's room, but you know, here it's different. So anyway, we were in the restroom and a lady came up to us and said, "I recognize your voices." She'd never seen Laura or me. But from hearing our talk, she knew who we were.
I have been accosted in a number of restrooms. This is the fact.
Yeah, and then the second question would be, where did you get your boots?
Yeah.
Because that's been the second most popular question. So if you're guys in the room, this is something to buy for the women. If you're not, you know, these are $25 boots on Amazon. So if you just do faux fur boots, they come in 5 different colors, and they're between $15 and $25. So please feel free.
And she's not making a commission on the boots.
No, I'm not. But they come in pink and green, and so they're really fun. And I get more compliments on this pair of boots, my cheap $25 boots, than on anything else that I typically wear. So
you're standing right on the cords, Marty. You're going to give me a hernia.
Okay, don't have a heart attack. Okay, so we're going to talk tonight about stuff we bet you didn't know about raising dogs, breeding dogs. And this is pretty free form. I've done this one other time, and it's really just sort of a bunch of stuff that I put together, and we can go through 150 slides or we can go through 15 slides. I don't really care, as long as we talk about the stuff that you want to talk about. How many veterinary professionals, vet techs, veterinary assistants, or veterinarians do we have in the room? 1, 2, 3, 4. Okay. So after the presentation, come talk to me, because I have a special thing for all of you that work in the veterinary profession. So a couple things. I also, Laura probably said this at some point, that I was Westminster Veterinary of the Year in 2023. It was super exciting.
I've said it a couple times.
I know, a couple times. Not tonight, which is super exciting.
You see how she is, right?
Because it was a really huge honor, and I beat out some really amazing
including Anders Thorson, who's from here.
Yes, and I met him at the Therio meeting. I went up to him and I said, "I'm really sorry, but you're really young." So you'll have another opportunity, but I'm old and I won't get another chance. So if I didn't make it this time, man, I was going to be done. So anyway, like she said, I do practice every week. I'm in practice. I have 3 practices in Wisconsin. So when I talk about this is not just theoretical. I've worked with breeders my entire career. I remember my first C-section on a beagle. So I've done this for 42 years.
You are a breeder yourself.
And I'm a breeder. So I have bred 3 bitches this year that didn't get pregnant. I've got a bitch I'm breeding tomorrow. My husband is orchestrating that. So,
oh God, Dr. Dan's in charge?
He is. But he's not actually doing the breeding. He's making the phone calls. He's getting the bitch, he's getting the dog, he's getting the staff. That's all taken care of. But we have 3 practices in Wisconsin. So this is what I really do. I work with breeders every single day, and I love, love, love working with my breeders. And just so you know, AVMA, American Vet Med Association, just had a meeting, conference in Chicago last month with a group of veterinarians, USDA people, and a group of other people there, including AKC. There were about 25 people, either virtual or in person, trying to figure out how veterinarians can do a better job working with breeders. Do we think that's about time?
Yeah.
So I'm not sure exactly who's funding the project, because they wouldn't tell me. There's money coming from somewhere. I'll always follow the money. But anyway, they're trying to figure out some of this stuff. They broke us up into focus groups, and they're working on trying to improve the relationship. So I think it's really important that you know that. So I'm going to wager that even as much experience as everyone in this room probably has, that at least one slide in this presentation will be like, huh? So what you don't know about Laura and I is when we do our podcast, we're on camera with each other.
She blows my brain up. Like,
and I'll be talking along and I can see her facial expressions and her hand expressions, and I'm like, okay, gotcha again.
Every time. Seeds under the Arctic Circle. I had messages about that.
I know.
I swear to God.
Look it up, man. It's true. Yeah, there is a seed bank under the Arctic Circle where they have seeds, over a million seeds frozen, so that it's like 700 miles north of the Arctic Circle, I don't know, some ridiculous place, super cold, even colder than here, that will then retain seeds, food crop seeds, if something catastrophic happens. So it's actually pretty cool. So what I want you to do is ask questions, be interactive, let's have a conversation. There's some handouts on the table. There aren't enough to go around because I only had so many pounds in my suitcase that I could accommodate. And since I brought a dog and a crate and stuff to show the dog, this is a Danish Swedish farm dog for those of you who don't know. When you travel with a Danish Swedish farm dog, you need to take a leash. Okay? That's it. No grooming, nothing, a leash. Crate. And she's never slept out of the crate before in her life, but she's like, there's something to this thing. It's pretty cool. So please, let's be interactive. Let's have some conversation. And we're going to start off with asking you who this woman in this photo is. This is Virginia Apgar. Does anybody know the significance of Virginia Apgar to our dogs? To us.
Got an answer over here.
To humans, yes.
Well, vaguely, I believe that she developed a system for evaluating human infants and got neonates as soon as they were born to see how they were.
Absolutely correct. So her name is Virginia Apgar. She graduated from medical school in 1933.
Oh.
Anybody know how many women were doctors in 1933?
One.
Yeah, one. That's her, right? So she was the first board-certified female anesthesiologist. And in the 1950s, when I was born, and many of you in this room were born, they anesthetized our mothers for our birth. They didn't have any of this natural stuff. Like, what is that? Like, they give them anesthesia. So they had babies being born from anesthetized mothers, and so she developed a scoring system, which she brilliantly named the Apgar score. So every day in practice, people still talk about Virginia. She did go to school in New York City. She did do a residency in Wisconsin. So it's actually pretty cool. But I think it's really interesting that she has done this for us. So APGAR stands for Appearance, Pulse, Grimace, Activity, and Respiration, APGAR. Peggy Cutzritz, who's a theriogenologist on staff at the University of Minnesota, modified it into something we can use for veterinary. So what I want you to know is that your veterinary clinics can score your puppies if they're born either vaginally or by C-section, and you can do that too. Now, intuitively, you're probably already doing some of this. You're looking at your puppies and knowing whether they're coming out. You know, if I hand off a puppy at C-section and it's running across the towel, and the staff member's like trying to keep a hold of it, and it's screaming, it's a 10. You know? That's pretty easy. And if it comes out dead, it's a 0. But there's a lot in between, and I think it's important that you start thinking about these scoring systems for your vet clinic, for you, so that you know how to identify which puppies are at risk. So I have a whole hour lecture on this. We're not going to do that because we would only get one thing done tonight. But basically, we know puppies with a score of greater than 7 or less than 7 have a 22-fold increased risk of death in the first 8 hours. And these numbers come from NeoCare. NeoCare is at the Toulouse Veterinary School in the south of France. So when I put up numbers like this isn't Marty Greer made this up. This is Toulouse. They studied, I think it was about 300 litters of puppies. So they did 4,801 weight measurements. They did all kinds of really great data points. So we have a lot of information. And we also know puppies with a score of 4 to 7 can achieve a 90% survival rate if you intervene appropriately. So it's important for you to identify which puppies are at risk, mark them with a collar, with a color, mark them with markings. You know, if you have spots on your puppies, if all your puppies are black labs, you're going to have to do something to mark them. If you have spotted dogs like I have, you can sometimes tell the difference. But I think it's important that you use this scoring system as a device that you can now really pay attention to your puppies and know who needs to be monitored more closely for weight gain or weight loss, respirations, pulses, temperature, urine color, all the parameters of the things that we can measure on puppies. So keep the APGAR score in mind, and if your vet clinic is not currently using it, encourage them to learn to do it. It's very simple to use this chart to do those things. And if you have the book, it's in the book. If you don't have the book, it's online. So it's good information for you to have. So that's important. I do have a few of the books tonight with me. I have 2 pandemic puppy books, and I have 3 remaining.
No, there's a whole box over there.
No, I think I emptied it.
Really?
Yeah, it's empty.
Okay.
There's only 3 left. That's good, because I don't want to take them home. And then I also have feeding tubes and DVM mucus traps. So if anybody needs any supplies, I have those. I only have what I brought with me because my suitcase was overweight. Like, looked really sad at the counter when I was checking in. She let me go a pound over. All right. So that's neonates. So like I said, the veterinary professionals come speak to me afterwards because I have a special thing for you for neonates. All right, NAIR. Some of you may have heard this on Laura's podcast.
If you listen to the podcast, you know the answer to this question.
So what would you do with NAIR in a dog? Nobody listened to
Podcast listeners!
I did, but I'm trying to remember.
Don't remember. Okay. Who has dogs with hair in their ear canals?
That's it.
Okay,
Yeah.
fair number of you. So if you have poodles, if you have schnauzers, if you have hairy dogs, Bichons, dogs that need to be groomed, to grow hair in their ear canals. I have Danish Swedish farm dogs and corgis. We don't have that problem. I had a Commodore for a while. She did have that problem. So NAIR is safe to use in the ear canals. So if you're a groomer, if you're a dog owner that has hairy dog ears, you can put this in their ear canal. I do encourage you to put it in with a cotton swab and not just put a big squirt in, because if they shake their head and it blocks out, I'm not responsible for that.
And I would also say, Marty, and wouldn't you recommend test it first, a small amount, just to make sure your particular dog is
That it
not
doesn't react.
hypersensitive? Yeah.
Yeah, and I do use the one with aloe in most cases because it's a little bit more soothing. But that's just, so who in the room has never heard of NAIR in the ear canal? Okay, so at least I have half of you in the room going, okay, I can
Didn't listen to the
now.
podcast, man.
I learned something. Exactly. Okay, what would you do with this octopus? This octopus, by the way, has 5 legs.
Not 8.
Not 8. So I'm not sure why they call it an octopus.
So it's not an
It's
octopus.
a pentapus.
It's just Pentatonics, people!
Am I going to be in trouble?
You are in trouble. You're totally busted. Fortunately, we're in Washington State, so you probably won't be arrested.
Okay. So I found this from a client. Most of the stuff that I'm putting up here tonight are things that I learned from clients because they're smarter than I am. So anybody know what to do with an octopus? What's that? It's actually great to lay out flat in a setting where you have puppies that have a tendency to become flat-chested. So this was a singleton puppy in the incubator here. She loved her octopus. She liked to be on that. Her name is Harbor. She was born on the day that Jimmy Buffett died. So the octopus will help you prevent those flat puppies. So
Swimmer puppies,
the flat puppies, the overweight puppies, the puppies get flat-chested, puppies that look like, oops, went too far, puppies that look like this. It's a little hard to see.
Oh, shoot.
I was going to like
That was on my list of duties.
Laura's
and I failed.
fired.
Fired.
Okay, so you can see the caved-in chest wall on this puppy. Not yet. Okay. So can you see how caved in that puppy is? That's a corgi puppy. You can see swimmers in any breed. It doesn't have to be a bulldog. So those flat-chested, caved-in, pectus excavatum puppies. This octopus thingamajig, you can buy these online. And this one I do have, and I bought a bunch of them at the store. So if anybody wants one, I do have one with me that you can purchase. So if you're planning on having a flat-chested puppy, which I don't recommend, that's something that's useful. Okay, ibuprofen. Why do dogs eat ibuprofen? Because it's sugar-coated.
Yeah,
It's
got
sweet.
candy coated.
Because it's there. Yeah, because it's in your backpack, your purse, on the kitchen counter, on one of 100 places that it could be, in your kid's backpack, whatever. But they're sweet, they're flavored, and they are nasty, nasty, nasty things for dogs to eat. I had a law school professor that came home one day from work. Her Tibetan Terrier was nowhere to be found in the house. Found her collapsed on the floor, having ingested the bottle of ibuprofen. So they go into renal failure, they go into liver failure. She saved that particular dog. but they can get really, really sick with this. So be sure that you keep that out of harm's way. Kids come home with their backpacks, all kinds of things happen. You know, this is an aside, I don't have a slide on this. The week of Corona that they shut down all the dorms, all the colleges, we had all the kids come home from school. We had 3 marijuana toxicities in the practice that week. Because all the kids came home, threw their stuff in their room, and didn't realize that the marijuana that they brought home, marijuana is not legal in Wisconsin. Yeah, so it was kind
Legal
of
here.
Yeah, I know. You guys, your dogs do it all the time, but our
Yeah.
our dogs only do it when the kids come home from college. Okay, is Trident and other sugarless gum and candy bad for dogs?
Yes.
Yes. Why is it bad for dogs? What? It's xylitol. What does xylitol do to dogs? Liver and kidney failure, mostly liver, and it drops their blood glucose significantly to the point of seizures. So we've had clients call with their dogs that they've seen normal, and then they come into the room staggering because their glucose went down to 30. So it's very important that you know that happens. If it does happen, start stuffing your dog full of ice cream and get to the vet so that you can get that treated. If it's bad enough, they do need to be in the hospital to treat them for the liver failure. Xylitol, everybody knows about. It's hard but not impossible to find peanut butter that does have xylitol in it. I had to look really hard, but Go Nuts is one of the brands. Most of the time you're not going to find that at your regular grocery store, your regular Walmart. It tends to be Whole Foods and some of the other fancier grocery stores. The other name for xylitol is birch sugar. They're now hiding the name xylitol on labels. So don't let that get ahead of you. Make sure you read the labels on all the products. We've had multiple dogs come in with the xylitol toxicity. Kids especially, they got sugarless gum or sugarless candy in their backpack. They hide it in the blankets. They try and do something so that they think the dog won't find it. And you know, it's good for your kids, but it's not good for your dogs. All right. It's also frequently seen in melatonin supplements.
Oh.
And some of the other nutritional supplements that you may be picking up over the counter on the human side for your dogs. So I've seen it in multiple melatonin samples, so just be aware that anything you buy that isn't necessarily dog labeled, that you're checking the back of the label, that you're reading the fine print. You have to put on your readers to do that, but it's there. All right, what's in this x-ray?
Pepto-Bismol tablet?
Good answer. You win the prize, the first prize, Pepto-Bismol tablet. It looks like a quarter or a nickel. That's a Pepto-Bismol tablet. So if you have a dog that's vomiting and you go to the veterinary clinic and they take an x-ray because your dog is vomiting and they come in the room and they say, well, we're going to have to go to surgery because your dog has ingested some metal, that's actually Pepto-Bismol. So if you use Pepto-Bismol, which I don't recommend for reasons that we'll talk about in a minute, just make sure that you're either using the liquid or if you are using the tablets that you talk to your veterinarian about the fact that you've done that. Now, Pepto-Bismol used to just be Pepto-Bismol, but kaopectate is now the same thing as Pepto-Bismol. It's no longer kaolin and pectin, which is really what kaopectate is supposed to be. You can still buy kaolin and pectin if you go to the farm store and buy a gallon of it, which is $12 and it'll last you the rest of your life because it's made out of clay. So the expiration date doesn't really count because it's clay, and clay is still going to be the same clay 500 years from now. So just be aware that kaolin and pectin can be bought at the farm store, online, as a kaolin and pectin product. And I don't mind that at all for newborn puppies, for pregnant dogs, for nursing dogs. But the human kaopectate is now not kaopectate anymore. It's really Pepto-Bismol, which metabolizes into salicylic acid, which is aspirin. And I don't want that going into my newborn puppies, and I don't want that to go into postpartum bitches and nursing bitches. So, can you give this to a dog? Yes, but those are my concerns. What about the paste? The kaolin and pectin, the pink stuff is probably Pepto-Bismol. You need to read the label to see what the back of the label says. If it says kaolin and pectin, you're fine. If it says bismuth subsalicylate, that's aspirin. So read your labels. Kaolin and pectin is safe. Kaolin and pectin, which is what kaopectate used
Spell
to
it,
be.
Marty.
Kaolin, Pectalin, Pectalin. If you buy the stuff ProViable makes with the little probiotic capsules and the kaolin and pectin paste, that one's safe. If you buy it from the farm store, if you buy it from Revival, any of those that are kaolin and pectin, those are fine. But if you're buying human kaopectate, it is not kaolin and pectin. It is Pepto-Bismol. I'm not sure how they got away with changing the active ingredients and not telling anybody, but it happened a few years ago, so it's not new. Okay, Puppy Light and Kitten Light. Anybody use these? It's a great electrolyte substitute for puppies. Works better than the kids stuff, like
Pedialyte.
Pedialyte is apple flavored and all kinds of other stuff. These are chicken soup based, so they do taste like chicken soup. What's the difference between Puppy Light and Kitten Light? Nothing. If they don't have Puppy Light, you can use Kitten Light. The reason they have two labels is because cat people don't want to put dog stuff into their cats. You're happy to put cat stuff into your dog, but cat people are, anybody in the room raise cats professionally, like breed cats? Because they're a different group. They're awesome.
They're awesome.
They're awesome, but they spend all their time online and none of their time doing anything besides cleaning litter boxes. So they don't walk their dogs. They don't do any of that stuff. Okay, canned spinach. Another question for those of you who may have been on our podcast. What do you use canned spinach for? Yes?
To clean out the stuff they eat.
Can clean up the stuff they eat that's small enough to come through. Do you want to see that she gets a Tootsie Roll?
Yes.
It's too far for me to throw it.
Tootsie
It'll hurt somebody.
Tootsie Roll orange.
So, these lovely things like ink pens that dogs chew up, diamond rings. We had one dog that ate 200 shards, approximately 200, I couldn't count them all on the X-ray, approximately 200 shards of metal shavings off the machine shop floor. The guy took the dog to work, and she got sick and was trying to eat stuff, but it was snowing out, so she didn't have access to grass, so she licked the machine shop floor and ate probably 200 shards of metal. Canned spinach pulled it all through. I mean, it was like you went cross-eyed trying to even look at the X-ray. So things like ink pens, things that are small and sharp, but are small enough to
The
come
rotisserie chicken that my kids
Yeah.
dog
Yeah.
ate.
through. Yeah. The razor, where they eat the handle, the plastic handle, the razor blade, the whole bit. Yeah, my son's in-law's dog did that. So we fed spinach to the dog and then made him vomit so that we could get those pieces up. So any of those sharp little pieces of things that you think can come through. Now, if it's a giant towel, it's not coming through. Don't do it with spinach. But if it's little sharp things, it'll usually come through. Floral wire, all kinds of stuff, yes.
How much and how long does it take?
It depends on the size of the dog. So big dogs get a full can once or twice a day. I have been known to squeeze the liquid out and shove it down dogs. I had a client that said, well, my dog won't eat that. Well, watch this. Because I'm bigger than your dog. Yeah. I'm
If
almost
you can
always
pill
bigger.
a dog, you can shove canned spinach down them.
Now, if they'll eat it willingly, great. If they won't, you can mix it with canned dog food or some hamburger or something else to mix with it and get them to eat it. But if you're going to make them vomit, just shove it down and then induce vomiting and have it come back up so that we could get the stuff out of the stomach. I didn't want the razor blade pieces to go all the way through the dog. I wanted those to come back up as soon as possible.
Does it make them throw up or makes them?
No, it just wraps around it, and it's got to be canned. The fresh spinach doesn't have that stringy, nasty. Who wants to eat canned spinach?
Grossness.
Like, I don't know why they even sell it in the store, because the only reason I use it is for dogs.
Right.
My mother used to like canned spinach. I don't even understand that. But, I mean, I like spinach, but not the canned stuff. So, frozen spinach and fresh spinach doesn't do the same thing. I don't know what there is about the canning process that makes it that stringy, nasty stuff. And you feed it until the green stuff comes through. So, it may be a day, it may be 3 days, but when they start having green feces, then whatever was in there has been wrapped in the spinach and is coming out the other end. So I recommend if you have those dogs that eat stupid things, like if they're small rocks, yes. If they're big rocks, no. So it depends on the size of the dog. But if you have dogs that do that, I recommend that you buy multiple cans of spinach, have it on your shelf in your pantry, because it's good for years, and you're going to need it, and you're going to need it when there's no store open or you can't get there because your car broke down or because it's snowing or whatever. So just remember, This sign says, I chew up whatever is available to me when my owners leave. Today it was a blue ink pen and these glasses. Anybody have a dog that does that? Yeah. Do you have a question?
Yeah, how would you compare that to bread and pumpkin as a substitute?
Not even close.
Okay.
I don't see any reason to use bread. I don't see any, because pumpkin is those short fibers.
Yeah.
This is long, skinny, stringy fibers, and it just wraps around stuff and pulls it through. I learned this from a physician. My sister, when she was in high school, was having a bridge put in her mouth.
I know this story. Ask
Yeah,
me
it's
how
a
I know this
three-prong.
story.
It was a three-prong covering 3 teeth, and her dentist dropped the bridge in the back of her throat as he was trying to put it in, and she tried to sit forward in the chair and spit it out, and he shoved her back in the chair to try and grab it, and it went down. So my mom worked at a human pathology center, and she went to the physicians that she worked with and said, what do I do? And they said, feed her spinach, and when it comes out, they'll autoclave it and put it in. And they did.
And if you listen to the podcast, you would know that story.
Yeah, because it's totally disgusting, but it's true. So when you come home and find your dog has blue lips, they ate a pen. Yeah, and vomiting, and I don't have a slide on this for vomiting, but I'm going to say it anyway. I don't recommend peroxide to induce vomiting. We've had some really bad effects from peroxide. I had a cat that died from it, and we've had a dog that developed an air embolism in her brain from peroxide.
Wow.
So I'm not a fan of peroxide, and of course Ipecac, syrup of Ipecac has been off the market for a number of years, but there's a product now called Clevor, C-L-E-V-O-R. It comes in a little aluminum foil pouch. Your vet can order it for you, and I would recommend if you have dogs that eat things that aren't appropriate, that you have one of those at home for you. Some vets will be willing to dispense it. You probably have good working relationships, most of you, because you see your vets a lot. And it takes somewhere between 1 and 4 drops, depending on the size of the dog. Little dog gets 1 drop, big dog gets 4 drops. In between dogs get in between numbers 2 or 3, and they will vomit usually within 3 to 5 minutes of the time you put that drop in their eye. It doesn't work on cats. It only works in the eye. Yes, I did not misspeak. We've used apomorphine in the eye for decades. When I first got out of school, we'd put a tablet into the third eyelid, and I would have clients come in with having their dog eaten rat poison or whatever, because we're in the rural areas and we see a lot of that. So I'd lift up their eyelid and put the tablet underneath their eye, and I'd have clients look at me like, okay, you're really young, and you're really stupid, and you're really doing this wrong. I'm like, stand back, because they'll vomit. So it works within 3 to 5 minutes, works very effectively in inducing vomiting. So if you have dogs that do that, be sure you have something at home. If it's small enough to go through, you can feed spinach. If it's too small to go through, or too big to go through, then just go ahead and get the Clevor and get it into your dog. So just kind of have that in your back pocket as things. There's a veterinary publication that every year has a contest called Your Dog Ate What? So veterinarians submit x-rays and stories about stuff dogs eat. I remember watching David Letterman one night, and a dog had swallowed a knife, handle first, went to AMC, the dog survived, but dogs will eat incredibly stupid things. I found a knife in my dog's crate. I'm like, are you trying to kill somebody, or are you just hiding it? Like, why is this in your crate? So just be aware that Clevor is a great little product for you to have at home. And if you have a good relationship with your vet, that's a great thing to have. Yes?
So what do you do with the ones that, like, if you send it home for people to use, if they don't stop vomiting, we usually have to get
Serenia?
Yeah.
Yeah. Yeah.
So do you send that too, or do you
Not usually, because generally they haven't vomited that much, and at least they've had stuff come up. So, and I had a client that came in a couple years ago on a Saturday morning. She walked in the door because she was raising a foster child, and the dog, she'd gone to the bathroom, left the baby with her husband, came back, the pacifier was missing. She looks at the husband, she's like, where did it go? He's like, I don't know, I don't have it. So she brought the dog in, and she's sitting in my exam room, and it's a Saturday morning, and if you've been to the vet on a Saturday morning, you know that those are busy days. We have one doctor in and like 800 clients, so it's pretty busy, and she started just freaking out because it was the 1 hour and 1 minute mark, and she was convinced that at 1 hour her dog's pylorus was going to open up, and everything in the stomach was just going to magically fall into the intestine. So she starts freaking out. I'm like, calm down. We're going to get to you. We'll get this taken care of. We were using apomorphine because we can give that as an injection. This was before Clevor. So I gave a dose of apomorphine, and we have a garage with a washable floor, so that's where we take all the dogs to vomit, because like we do this a lot. So my staff knows, like, you give the injection, you have to bolt to the garage so that the dog doesn't vomit on the floor on the way. And she's like totally freaked out because she's sure that 1 hour and 1 minute is too long for us to induce vomiting. We get up to the garage, the dog vomits up the pacifier and 3 black socks. And I said to her, we don't really know how long things are down there before they pass into the intestine. She's like, oh. I told my husband to keep an eye on the socks. Well, so dogs eat stupid stuff. All right, baby rice cereal. Anybody know what to do with this? I love this stuff.
Puppies.
Glue.
It's glue. Absolutely. I mix it with baby rice cereal with yogurt and baby chicken, Gerber stage 2 baby food, and I give this to newborn puppies or puppies that are really young that have diarrhea. That rice solidifies the stool. It's much nicer on their GI tract than pumpkin, so I use a lot of baby rice cereal. They also make one with banana. It's just that little flake stuff. It sits on the shelf at the grocery store. Again, it's good for 100 years because it's just a flaked product. And if you add some fluid to it, like yogurt and chicken baby food, it makes a really nice thing that you can put on your finger and then get those 3-week-old puppies to eat. Yes.
You had a question over here?
Yes.
You answered it.
Okay. So I just add enough. I mix it with chicken, Gerber stage 2, Gerber 2, the little jars with a blue label, Gerber 2, yogurt, and baby rice cereal. Really nice formula for puppies with diarrhea. When they're right at that 2, 3, 4 week weaning age. I do a lot of babies, can you tell? Okay, exfoliating gloves. What would you use these for on your dog? Baby chicken food, yogurt, and rice cereal. Yes, she wants another Tootsie Roll.
Pulling out a stuck puppy.
Yes, pulling out a stuck puppy. So you can buy these on Amazon. They're 10 pair for like $5. They come in multiple colors, and they give you a little bit of grip if you're trying to reach in vaginally and get a hold of a puppy. Those exfoliating gloves work. Okay, before our bitches whelp, what is the very most important thing to do before your bitch goes into labor with your veterinary clinic?
Get her to poop.
Puppy count x-rays.
Yes.
You want to know how many babies you're having before you know how many you're having. So it's really important that you do this. Now, if you're at more than 9 puppies, it can be a little hard to count. But up to 9, your vet clinic should be able to get you a pretty accurate count. Walking the bitch and fasting her before the x-ray makes a world of difference. The bitch should be at least 55 days pregnant so the skeletons are enough calcified that you'll see them. And you need to take her in before she eats breakfast and after she poops. If she doesn't poop before, what do? Match her. Okay. You can use suppositories, you can use matches. And you know how many people look at you like you've grown a second head when you say, I'm going to match your dog? I mean, everybody in here knows about matching, right? Yeah. But please use paper matches, not the wooden ones.
Don't light it on fire.
I saw a handler put wooden matches in. That's a little brutal. What'd you say?
Don't light it on fire.
Yeah. Don't put it in while it's burning. I don't want to say the hopelessly obvious. Yes.
Why paper over stick match?
Because the stick matches hurt when they come back out. They're painful.
Depends on how far you put it in.
It does, but I had a dog that came in one night to our clinic about 10 o'clock at night, and he'd eaten his doghouse, and he had a piece of wood crosswise in his rectum. Yeah, that's painful.
Yeah.
We'll just say he was a coonhound. He wasn't particularly bright, but he still knew it hurt. So he and his owner, the dog, his owner, and me were trying to dislodge this sideways piece of wood. I don't recommend it. Suppositories work great too. During COVID, you couldn't buy matches or suppositories. I'm not sure why. I mean, I get that everybody was baking bread, and so the yeast kind of disappeared off the shelf, but I don't know why suppositories were gone. Like, who was loading up on those? Okay, so when you get your x-rays, ask your veterinarian to do get 2 lateral x-rays, one with the right side down and one with the left side down. I don't care if it's left and right or right and left, it doesn't matter which order, but flipping them one side to the other, frequently we will see them go from not being able to count the puppies accurately to seeing, like, you go from 7 puppies to 8 puppies as soon as you roll her over, because that keeps those 2 puppies that were superimposed on top of each other, they move. And so the highest number that you count is the accurate number. So if you see 7 on one x-ray and 8 on the other, the answer is 8. Okay, what is this stuff called? Start of
Crack.
goals. It's wonderful.
Crack.
This is
Puppy.
puppy crack.
Puppy crack.
No, Royal Canin probably doesn't want us to call it that, but this is puppy crack. And this will get puppies to eat, puppies to wean. My corgi puppies will wean at 3 weeks of age. Like, the bitches look at them and say, "You're done. Get away from me, you have teeth." The farm dogs, those puppies are still nursing when they're 7 and 8 weeks old, and the moms are like, "Oh," they're like cavaliers. "Oh, just continue to nurse, it's fine." But this whole thing of getting puppies weaned, this is the most amazing weaning diet you'll ever use. It also works really well to top dress food for bitches that aren't eating well while they're pregnant, and it will get bitches to drink. If you open the can and mix it with a wire whisk and a bucket of warm water, she'll drink. So be sure you do that. My Royal Canin rep says just throw some in a bucket of water. I recommend that you open the can first. Okay, nomograph. What is it? What do we do with it? When do we draw it? What's it for? Yes.
It's for vaccines, for to know when to vaccinate your puppies. You can do it like 2 weeks before or 2 weeks after birth.
Correct.
Damn it.
You are absolutely correct. So
Diane
a
has an
nomogram-
extra Tootsie Roll.
Our nomograph is a titer, so it tells you what the bitch's titer is to distemper and parvo, and it'll tell you if you order the nomogram or nomograph from UW, from the University of Wisconsin, not Washington. Lori, what is her last name now? Lori Larson. Lori Larson will interpret the results and tell you when to vaccinate your puppies. Now you have to do it with each litter because the bitch's titer will not be the same in 2020 as it was in 2022.
You need to go back into the. Excellent. Well done.
Okay. So you can draw the blood, send it in to the UW. It's CAVID, CAVID is the name of the lab. So if you Google the CAVID lab in Wisconsin, and it'll bring up the requisition form. You can take it to your vet. They can draw the blood. They can send it in. And you are absolutely correct. Do not draw it within 2 weeks of the time she whelps, prior to or after. So that 4-week window, you don't want to draw the blood because all the antibodies are being sucked into her mammary glands to make colostrum, and they're not going to be in her circulating blood, so it's not going to give you an accurate result. So it will allow you to customize your vaccination protocol for each litter of puppies. So you may get a vaccination report that says vaccinate for parvo at 7 weeks and parvo and distemper at 11 weeks, and you're done. It may say vaccinate at 14 and 18 weeks. It may say vaccinate at 6 and 9 weeks. Everyone is a little bit different depending on the bitch's level. Yes.
I actually have a litter of 5 little puppies on the ground, and the bitch came back unprotected for parvo. And she's not due for vaccination until next March.
Right. Right.
So
So
it completely changed my socialization protocol.
absolutely. So you're now protecting your puppies because she didn't have antibodies that gave them protection. And that's really important for you to know because just because you vaccinate your dog doesn't mean she responded to the vaccine. So you may have an unprotected litter because she didn't respond to the vaccine. So vaccination doesn't equal immunity, and that's what you really have to remember. Last week I had a blood sample drawn on myself because we're going to go to Africa, and my physician was going through all the vaccinations that you have to have. And so she's going through the list of hepatitis and influenza and DPT and respiratory syncytial virus and reading all this stuff. And she goes, rabies? And I go, yep, I have that. And I'm probably the first person that's ever said those words to you. I have a rabies titer. And she's like, I think you probably are. So she did my rabies titer. I still have a protective titer to rabies. My last vaccination was 43 years ago.
Wow.
I was vaccinated once with the once with the egg cell, the duck egg embryo vaccine as a junior in vet school, and then twice with the human diploid cell culture vaccination in 1981, and I'm still protected. My husband and my son are not, my daughter and I are, just proving to you again that women are superior. So, we know that the titer drops 50%. According to this chart, this is how Dr. Larson calculates it, is she figures out what your titer is for your bitch at this particular point, and then it drops 50% a week, so she can graph it and figure out when to vaccinate your puppies. So if you stopped at a rest stop on your way to this dog show and your dog was exposed to parvo even though you didn't know it, she may have this huge spike between the last time you bred her and this time. Or she may have failed to respond well to vaccines, as you found out. So just because you vaccinate doesn't mean you're protected. So just keep that in mind, and this is a really great tool for those of you who have breeds that may not respond well to vaccines or that you're concerned about vaccinating too frequently. I had a client that came in this week with 2 corgis, and I said to her, are you sure you want to give distemper, lepto, parainfluenza, parvo, rabies, Lyme, and bordetella today? And she said, oh yes, I would like to do that for the dog. And at 6 o'clock that night, she was back because the dog was vomiting and had facial swelling. I'm like, see, this is why we asked this question. So, not everybody responds to vaccines the same way. Okay, yeah.
One more question on that.
Yeah.
What about once you place those puppies in a home and go to their veterinarian?
Yes. Great question.
And then it's the whole.
I know. And so I send a copy of the report with every puppy, and I have a letter that I drafted that explains. And even in Wisconsin, where many of these students had Dr. Larson as their instructor, sometimes it's a little bit of a battle. So it can be a bit of a struggle. You need to just make sure that they're well educated and that you're talking to these people well in advance, that they've talked to their veterinarian before they take the puppy, because they may just put them on the table and vaccinate for everything.
Right.
And that can be a challenge. But if you send a copy of the lab report, hopefully they're going to a veterinarian that's open-minded enough that they follow the instructions. And then the other thing was, if you have given plasma, and we'll talk about plasma in a little bit, but if you've given plasma, it invalidates the results because now you're giving them antibodies from another source.
That
Yes.
was my question,
Yeah.
that it then becomes
Mute.
mute.
Yeah. So I generally don't do the nomogram if I've given plasma to puppies.
We do it.
So I probably would find this to be very useful.
So, Marty, do me a favor and talk a little more on this, because a lot of people have asked me, and I struggle with it, the concept of there are many of us who are dog breeders who vaccinate our own puppies. And there are veterinarians more and more who are like, no, your vaccine doesn't count. I'm going to go pollute your dog all over again.
And
How do we talk to the veterinarians of our puppy buyers?
Right.
Should we just give it up? I mean,
Yeah, you have to work with a veterinarian that trusts you and that you trust them.
yeah, but I'm selling 9 puppies to 9 individuals who are going to 9 different veterinarians.
Right.
Not all 9 of those goddamn
Right.
veterinarians
There's
are
some of us
gonna-
in the room. Be careful.
Sorry.
Respond. One of the things that I was told by my retail vet convinced me to take an entire litter into her for a well puppy exam all at once and to have them do the vaccination was, if there is a record that a veterinarian has done at least one of the vaccines, you cannot be held liable.
Right.
If you are taken to court, somebody says, my dog died of parvo and I don't believe that the breeder actually vaccinated or whatever, you can't prove it. So you put a sticker on, whatever, they can say that you're lying.
Right.
Well,
Well, here's the thing. You've got to say the veterinarians have to be suspect because they don't know what your source of vaccine was.
I get all of that.
How it was stored.
So do we just give up the ghost? Do we just say,
Maybe.
never mind?
Maybe. I talked to a guy in Wisconsin a couple of years ago through Revival, and he was losing 1 in 6 puppies to infectious disease. And I said to him, well, you need to have your vet vaccinate your puppies, because then you have a vaccine manufacturer standing behind the product, and they will pay for postmortems, they will pay for figuring what's going on. He said, well, I can't afford to do that. And I said, well, how much are you selling your puppies for? He told me he was selling them for $400. I'm like, okay, well, herein lies the problem. But when you're selling puppies for several thousand, which most of us in the room should be, if we're not, the doodle people are. So, they're selling their puppies for $3,500 to $4,500. So you should be charging at least that much for purebred, well-bred, health-tested dogs that have champion parents and health screening. So I would suggest that, yes, you probably should follow that recommendation that at least one vaccination comes from your veterinarian. And then you've got a vaccine company standing behind it.
I'm going to say that's what I've gone to, simply because I'm not willing to fight the 9 other veterinarians, and because I am a complete weenie ass and I can't microchip my own puppies. I can vaccinate them, but I can't microchip them.
Small needle, not a nail.
And so that's where I've gone to, but I just wonder, there are plenty of people, my mother's era, who are still vaccinating their own puppies. So
but we don't
what's
know
the
where
answer?
Vaccine, did you get it from the farm store?
I got it from Revival.
Right, but did you get it from a crappy farm store? They don't know. They don't know where you got it from. Did you get it from a crappy farm store? Did it sit on your front porch in the sun when it was delivered? Did it hang out on your refrigerator door so every time you opened it to get the milk out, you warmed the vaccine and it went back in? Did you administer it correctly? We had a Revival client that called me one day and he had 9 puppies to vaccinate. And after 8 puppies, his 2-year-old opened the gate and all 9 puppies commingled. He couldn't tell which puppy got the vaccination and which one was still missing it. I'm like, dude, I can't help you. If you have a 2-year-old, that's, your issue. So when I vaccinate puppies, we have 2 X-pens set up for the puppies that aren't done and the puppies that are done. But not everybody does things the best way. So if you're not doing best practices, that's the problem, and the veterinarians have to protect themselves. So you have to understand why.
Well, and that's what I wanted you to kind of talk to people about.
And I'd say that like 90% of the parvo cases I see, when you ask them, and especially in my area, semi-rural, 90% of the people said, "Oh, I give them farm store vaccines," and here's the parvo cases.
Right.
So it tells
And
you
it's old vaccine technology that's not well stored and not well shipped, and
the first was it's old 80s technology.
Correct. So there's the problem, and we'll talk about parvo in a few minutes. All right, let's see if we can get the video on this thing to play.
Yeah, a question.
Yes.
We got.
Sorry. Would you repeat again where to get the milligram and which lab to send it to?
Right, it's University of Wisconsin in Madison. It's the CAVID lab, CAVID. So if you Google CAVID lab Wisconsin, it'll bring up the requisition form that you can take to your vet and all the information you need. CAVID. I'm not sure what CAVID
Not
stands
COVID, CAVID.
for. CAVID, CAVID, not COVID.
What age should the puppies be like to pull the blood on for them?
Well, if I'm doing the bitch, then I don't have to do the puppies.
But if you did,
If I'm doing the puppies, it depends. Are you trying to decide if you're doing it at 4 weeks before you start your vaccination series? Are you doing it after they've had 1 or 2 vaccinations to see if they've responded? You have a couple ways that you can use that.
Trupanion is revolutionizing medical insurance for pets by providing the best possible experience to our members. And it's not some space-age dream. It's happening now. We pay your veterinarian directly while you're checking out, and we're the only ones who can, which means you have decisions in seconds, and you don't have to wait for reimbursement. So unlike with other providers, you'll keep more money in your pocket. Ask your veterinarian if Trupanion can pay them directly, because there's pet insurance, and then there's Trupanion.
All right, well, on the video is evidence of intestinal motility and a kidney development. So on ultrasound, and because I didn't store this correctly, it didn't show, on ultrasound, if you're trying to time a bitch to see if she's ready for a scheduled C-section, your veterinarian, if they've got some experience in a good ultrasound machine, can find the kidney, which is this structure here, so that's the puppy's kidney. And they can see intestinal motility, which unfortunately, because the video probably isn't going to play, it's not going to. Wait, maybe it will. No, yes.
It
maybe.
doesn't love you.
No, it doesn't love me today. So on ultrasound, your veterinarian can take a look at the newborn or the neonatal puppies before they're born and see if the puppy has intestinal motility and kidney development to tell you if the puppy is mature enough to be born by C-section that day. So progesterone isn't the only tool that you have. Progesterone is helpful. Breeding dates are not terribly helpful. Progesterone at ovulation or progesterone at the end of the pregnancy can be very helpful, along with intestinal motility and kidney development, to see if the puppies are ready to be born. Okay, this is one of my favorite topics, tetrazuril. Anybody using tetrazuril in the room? Go ahead and admit it. Okay, not very many. All right, is this a U.S. approved drug? Does anybody know what people are using it for? If you're not using it, coccidia. Okay. Okay. Who honestly is using tetrazuril in the room? Be honest. Okay.
Never heard of it.
This is a drug that's never been approved for use in the United States in any species. Not in horses, not in cows, not in pigs, not in dogs, not in cats, not in any species. I have a very serious concern about using a non-FDA drug in the U.S. If I have puppies with coccidia, I use Albon. I've had people tell me they don't think Albon works anymore. Who's using Albon and not having it successfully work for you? Okay, so we're going to talk about a couple of tricks that you can use. Albon comes in liquid and it comes in tablets. I use liquid for the puppies because it's so much nicer to give than the tablets. And the stuff tastes really good. Has anybody tasted Albon? Because I taste everything, whether I want to or not. Sometimes it ends up on me. And it's like banana pudding flavored. Tastes really good. The puppies take it really well. You give it once a day for 5 days in a row for coccidia. Ponazuril I will use if I have to, if I have a treatment failure with coccidia. But I will not use tetrazuril. There is no U.S. product in any species. And I can't say that enough times, enough ways. It is approved in England for dogs. It is approved in England, Australia, Canada, in pigs, cattle, sheep, and poultry, but it is not approved for dogs in any country other than the UK, Britain, Great Britain. I have serious concerns about the use of this drug. Do you know if you order tetrazuril, there's multiple places you can go to tetrazuril shop. I'm just going to tell you honestly, you can go there. I get an email every week from the tetrazuril shop. They send it to me, say please buy tetrazuril. Horse Pre-Race sells it, so you can buy it in the United States. But do you know what their location is? Florida. Florida. If you look at the map of where their company is located, it shows you a map of Florida. Now, about 15 months ago, I was working on a project with another veterinarian, and I Google searched the address that they were listing for the tetrazuril shop. It was an apartment building in Orlando. Now it's just Florida. So who do you call if you have an adverse reaction to this drug?
Nobody.
Nobody. Who do you call if you have an adverse reaction to Albon?
Yeah.
You call Zoetis. And Zoetis will take care of your problem. You cannot call the state of Florida and say, I'd like to find the tetrazuril people. What happens with drugs that aren't approved for use in the United States? What happens when we have compounding errors? Does anybody remember the compounding error that happened in Florida with the polo ponies? This group of polo ponies were unloaded off of a boat that came from Venezuela to Florida to do polo pony stuff, races, or games, but they play polo on ponies. They injected selenium into these polo ponies as they unloaded them off the boat, and 26 polo ponies dropped dead on site. Frank's Pharmacy was a compounding pharmacy in Florida that miscompounded the drug. Frank's went bankrupt because no one can afford to pay for 26 polo ponies and not lose something. These are pictures of people this is a vet tech in the hospital. These are guys that are standing next to the dog, or the polo ponies watching them die on the shore where they unloaded them. I don't want to have you have a situation where there's a compounding error, where there's a drug that doesn't give you protection.
Right.
This was devastating. You can Google it. Many of the pictures that used to be online have disappeared because I'm sure they don't want anybody looking at them anymore. But this is what really happens if you don't have a drug company that stands behind you. So if you have a problem with Albon, you call Zoetis, and Zoetis guarantees their product. So you can call Zoetis. You can get help. If you have that problem, you go to product support. But there's a few things that you can do with your Albon and with your fenbendazole and your Strongyne and your Nemex, your parenteral pamoate products that will improve the efficacy. And we'll talk about that in a minute. What about fenbendazole? Anybody using fenbendazole during pregnancy? Yes.
Safeguard?
For
Is it Safeguard?
Safeguard, yeah.
Safeguard,
Yeah.
Panicure,
Warming.
and fenbendazole are all the same products. Yes.
So warming.
It is a deworming product. And it can be used very effectively during pregnancy and early lactation to reduce the risk of transmission of roundworms and hookworms from the bitch into the puppies. So you can deworm your bitch until hell freezes over. She can have a negative fecal, but if she had roundworms or hookworms as a puppy, those will insist in her muscles, reactivate the migration during the pregnancy and lactation because of those stresses. They'll migrate through the milk if they're roundworms, through the milk if they're hookworms, through the placenta if they're roundworms, and into the puppies. So this is how puppies are born with parasites. Many of you in the northern states don't have too much problems. In Canada don't have so many problems with this. But if you've purchased dogs from the southern states and they have roundworms or hookworms as puppies, they will transmit those to their puppies, okay? So it's a very safe product. It works really well. I give it for the last 3 weeks of pregnancy through the first 2 weeks of lactation. So the label says 3 days. I use it for 5 weeks. So yes, this is an off-label use. But it's different than tetrazzeril because tetrazzeril is not a labeled use drug in the United States. Fenbendazole is labeled for dogs for use in the United States. I have veterinarians that say, or clients that say, I've gone to my vet and talked to them about this protocol of 5 weeks during pregnancy and lactation, and they say that must be new. I don't know anything about that. I'm not going to do it. I don't know what you're talking about. The original articles were published in 1983 and 1979. Those are 42-year-old articles. Yes?
Standard dosage?
Standard dose, 50 milligrams per kilogram once a day, standard dose.
That goes for quite a bit.
Yep, you can use the granules, you can use the suspension. I don't use the paste because the paste isn't uniformly distributed. The drug is, when you get a tube of paste, it comes with the expectation you're going to use the whole amount in one animal. When you're using bits of it, it's not evenly distributed in the paste. But in the suspension and the granules, it's very effective.
What's
So-
the dose again?
50 milligrams per kilogram once a day.
Package dose.
Package dose, just the regular label dose. If you're using the suspension, it's 1 cc per 4 pounds of body weight. If you're using the granules, they come in 10, 20, and 40-pound packets. So if you have a 10-pound dog, you give a 10-pound packet. If you have a 50-pound dog, you give a 10 and a 40, gives you 50. If you have a 90-pound dog, you give 2 40s and a 10. Yeah.
You did say Panicor and Safeguard.
Panicure, Safeguard, and fenbendazole are all the same product. Yes.
When do you start giving that,
Day 42 of pregnancy.
day 42?
And you give it till the puppies are 14 days old. So 5 weeks. Once a day for 5 weeks.
42 days.
42 days. So the 42nd day of pregnancy is when you start it.
And do you get that from a vet or can you just buy
You
it?
can buy it over the counter.
Over the counter?
You can order it off Amazon.
You can get it from Amazon, you can get it from Fleet Farm, you can get it from Tractor Supply,
Oh,
you can get it from Revival.
okay.
There are many sources for it. It's not, so some is prescription, some is not. You don't have to have a prescription for it.
Okay.
So the way this works,
Excuse me, I have a question.
yes,
On coccidiosis, is there, so we have one bitch that her puppies always get infected with coccidiosis. Is there a protocol, something there?
yes, and we'll get to that in a minute.
So coccidia is coming next.
Right. So fenbendazole, and the reason these are all together is because they're all suspensions. So this is the label dose for fenbendazole. Everybody got a picture?
No.
Okay.
Did I hear that this is gonna be posted online?
The entire seminar is being recorded and will be posted, the video, to Pure Dog Talk's YouTube channel.
So if you're using fenbendazole, Panicure, Albon, Strongyne, Nemex, any suspension product, any of those suspensions, they can be a little bit challenging to use. And one of the reasons I think people have treatment failures is, number one, I think they're not weighing their puppies accurately. So you need to put your puppies on a scale when you're deworming. And don't go, I think this one weighs about 3 pounds. Put it on a scale. Number 2 is calculate the dose according to the label. So use math. If it's 1 cc per 4 pounds and it's an 8-pound dog, 2 cc's. And then what you want to do is shake the product well when it first is delivered to your house or when you first buy it. Shake it up well and pour it into these smaller brown bottles. The reason being that when those bottles come, they're a suspension, they're like paint. The bottom is thicker than the top. So if you shake it really well and distribute it into those smaller bottles, number 1, you'll have more even distribution. Number 2, you're going to have less head space in this bottle than you will in this bottle when you've got it half gone. So you're going to have less deterioration of the product because it's not going to have that much air in contact with it. So if you're having failures with Albon or with Nemex or with Strongid or with fenbendazole, these are the things that can make a difference in your treatment protocols. So I don't care what product it is. If it's a suspension, that's going to make a difference. Now, if you're using the tube products, like I said, I don't use fenbendazole in the tube. I don't use any of those in the tubes because, again, this tube is meant to treat a 1,500-pound horse. And if you're giving little dabs of it, you're not going to necessarily have even suspension of the product through the tube. So don't use the tubes, use the suspensions. And then if you have a problem with coccidia or giardia, be sure that you're removing organic material in your kennel and you're disinfecting afterwards. So that means use soap, a detergent, to get rid of the organic material, the fats, the feces, all that stuff, and then use your disinfectant. 2 years ago, I was at Revival and I had a client that came up to me and said, I lost 76 puppies this year. I think I'm going to leave the breeding program. I can't deal with this anymore. He came to me this year at the meeting and said, I started using soap and disinfectants and my puppies aren't dying anymore. So it's amazing what hygiene does for you. Yeah. No poop, right? Okay. Any questions about those products? Okay. So does that help you with coccidia? So there are some bitches that just seem to have a problem with it. Bathe her before she has her puppies. Do you have a long-coated dog? What breed do you have? Okay. So the long-coated dogs, like my Corgi, I've had coccidia in my Corgi puppies before they're even 3 weeks old. So I know that came in from the bitch's feet or off of her pants. If you have a tailed dog, you can wrap their tail, like golden retrievers. You can wrap the tail. If you don't have a tailed dog, or short-coated dog is probably not going to make a difference. But some bitches just have a lot of problems with coccidia. So just deworm her, but don't do it while she's pregnant because trimethoprim sulfa and Albon will cause birth defects if you give it before the puppies are born. All right. Of the oral flea and tick products that are on the board, Credelio, Simparica, NexGard, and Bravecto, which one is labeled for use in pregnant and nursing dogs? There's one up there that is. Bravecto, yes. What is a breeding dog? Male and female, yes. Your 4-week-old male puppy that's going to be your next stud dog is a breeding dog. He's never going to get pregnant. I got that. But Bravecto is the only one of those products labeled for use in breeding animals. So if your vet is sending home Simparica, NexGard, or Credelio, they should not be using those on your breeding dogs, pregnant or not. Yes, Katie?
What happened?
We don't know because no one's tested it. Bravecto has been tested in those breeding animals. The other 3 companies have not paid for the testing and not put their dogs through that treatment. Bravecto has been used on beagles that are in a breeding colony, and so we know that it's safe.
But Bravecto is not approved, or we can't use it for the MDR1.
Yes, you can. Yeah, it's not an MDR1 drug. Okay, what is the minimum time between vaccinations and why? How frequently is the most frequent you should inject your puppies with vaccine? 2 weeks, correct. You can do it less frequently if you've got the right setting. But we have some people that believe if 1 vaccination is good, more is better. It's mostly a problem in the commercial breeders, but we do have people that are vaccinating as often as every 7 days. Well, don't do that. That's bad for their immune system. Okay, this I learned from Laura. How do you weigh a wiggly puppy?
Do you have it?
I didn't bring the scale.
You didn't bring the scale?
No, I had to delete certain things out of my suitcase.
If you told me that, I'd have brought
There
one.
was only so much I could bring. So, how do you weigh wiggly puppies? Mesh bag
On a fish scale.
and a fish scale. And when I say fish
A
scale,
luggage scale. We use a
luggage scale is fine. Fish scale, not scales on a fish. A fish scale. So you go to the tackle box, or you go out to the luggage weight, and you put the puppies in a little mesh bag. So they're easy to weigh when they're a day old, but once they get to be about 2 weeks, they're all over the place. So when I said weigh your puppies, put them in this little bag and weigh them.
It works a charm, y'all.
It does.
It does.
I'm telling
It
you,
does.
I spent 25 years weighing them on my mother's food scale that was like older than me. And they'd like fall off and knock the thing off. And you got this, and it's like magic. Magic.
Fish scale. Okay, can you breed back to back?
Yeah.
Yes. Should you breed back to back?
Yeah.
Yes.
Yes. You should breed back to back. Probably breed 2 times, then skip a breeding, and then breed back to back again. It takes about 8 months for a bitch to get nutritionally back to the plane she was at prior, so I like to only do 2 in a row and then give her a break. But a pregnant uterus is a happy uterus, so keep her pregnant. You're not going to have so many problems with pyometras, with cystic endometrial hyperplasia, and all that stuff. And when I say back to back, I don't mean this. Yes.
So what are your short cycles?
If she's short cycles, she's probably not going to get pregnant anyway, because they need at least 4 months between heat cycles to get pregnant.
And that's what she's doing, it's like 4 months, 10 weeks after the pups are born, she's going right back into her season again.
Well, yeah, but that was still 4 months from her last heat cycle.
So that's okay.
That's long enough.
Because I'm like,
It's
girl, you're
it's
they're
the
only 10 weeks
it's
old.
the start of the heat
I'm
cycle to the start of the heat cycle, not from the weaning to the start of the heat cycle. So it's okay to do that. She'll probably get pregnant. You had a question?
How would you approach a breed club that in their code of ethics makes you sign it, saying that you cannot breed more than once a year?
Yeah.
Or back, like a back-to-back.
I would work on educating them.
Yeah.
Because you're right, there are some code of ethics, and they also tell you other things in their code of ethics, yes. So I'd work on educating them to say that the theriogenology veterinarians are a fan of breeding back to back. A healthy uterus, a happy uterus is pregnant. Yeah. Okay, what if your vet oh yeah, sorry.
Okay, I lost a singleton last May. I want to breed her again, but I'm not sure where to take the amount of time between, whether to take it from when she ended her season or when the puppy was due to be born.
Start of the heat to the start of the heat. So if the puppy was born in May,
The puppy, it was a singleton,
Right.
the placenta broke and drowned, and we had to remove it. The
Right.
uterus or nothing was ever.
but she was in heat in March, so she had the puppy in May. So when she comes in a heat breeder,
I know. Where would I gauge when that is?
typically 6 months. So if she was in heat in March,
She's over 6.
yes, you would have been in heat in September, so she should be coming in any time.
That's
Yeah, what do you feed?
we're on. That's another question I have for you too. I have her on Purina,
Okay,
weight management.
okay. Weight management's not gonna cut it for her. She needs to be on Pro Plan, the Sport 30/20.
I tried to get on the website, and one is down, and then 2 is just not working.
Go to the farm store. They sell it at Yeah. pet stores, farm stores. Purina is available.
Another question, maybe you can expand on this, that you're talking about feeding. Plant-based estrogen in grain foods, in grain-free foods. I read where it actually fools the fertility of the bitch.
Yes, it does.
Grain-free?
Can you expand on it?
Yeah, the grain-free foods are a problem. Bitches need carbohydrates to lactate. Bitches need carbohydrates to make their puppies grow. So grain-free diets are not recommended. Now, HT42D is the Royal Canin pregnancy diet. It is a soy-based diet, but they chelate the phytoestrogens in that, so they're not a problem. But most of the other grain-free foods are going to be a concern for you. So I don't feed grain-free to
Yeah,
dogs that
I
are
took her
on.
off of that before
Yeah.
we got her started
Yeah.
on her last pregnancy.
Yep.
But due to the fact that, no emergency vets would take her in time, and my vets were closed on the weekends,
Yeah.
we lost the puppy.
Yeah. And that sucks.
Fantastic.
So I do, it is another conversation. I do Be Strong and either Royal Canin HD 42D or Purina Sport 3020 as the diets that I recommend. I feed Royal Canin at my house.
What was the first one, please?
HT 42D. It's Royal Canin's pregnancy diet. Worst name for dog food ever invented. It stands for heat to 42 days. So you feed it from the start of the heat cycle to the 42nd day, then you switch to the puppy, or you can feed Purina Sport 3020, and that's easy to find. You can go to almost any farm store, any pet store, and find HG, or find that. Okay, if your bitch has a C-section, and your bitch's uterus on the inside looks like that, what is that? It's ick. Yeah, that's the technical term.
Yeah, that's the super technical term, ick.
So these brownish, grayish, slimy plaques, what are these? They're resorption sites.
Resorption
Yep,
sites.
those are resorption sites.
Oh, wow.
You can culture those, they will grow nothing. That is not a pyometra. Do not let your vet spay the dog or the emergency clinic spay the dog because of that. What should you do if you see that at the C-section? Antibiotics don't really make a difference because if you culture it, it's negative, nothing grows. So what do? Your vet's in surgery, they come out, the technician comes out and says, this stuff is going on in this uterus. You want us to take it out? The answer is no, but those are
Biopsy?
resorptions. Biopsy. Who said biopsy?
I did.
Yes, correct
You get
answer.
another Twinkie.
Tootsie Roll. I'm out of Twinkies.
That's
So
cookies.
those are resorption sites. Get your vet to take a biopsy. Get your vet to send the biopsy to the Ohio State University. Chris Permerandin there is the veterinarian who's double boarded in therio and pathology. He's like way smart. And we're sending, at this point, we've been doing a study with the theriogenology group. So we're taking biopsies of normal uteruses and sending them to Dr. Permerandin so that he can assess what a normal uterus looks like at full term. They wanted to get 200 samples. They're going to call it done in December, so we're just about to the end point. He's got 100 samples. I think 75 came from my practice because I'm strongly supporting him. So we're going to be able to tell what normal is and what normal isn't. These are cysts. These are plaques from resorptions. I had a vet student with me at one point that I said, so I want you to look at this and realize that these are just resorption sites. And she gasped and she took 3 steps back and I said, uh-oh, what happened to you? And she said, they spayed my bitch. They told me that was a pyo. That is not a pyometra. Can you have a pyometra and a pregnancy at the same time?
No.
Yes, you can.
Oh.
It's really rare. I had one client who was also an employee, had a bulldog, 4 puppies in one horn, pyometra in the other. Yes, it can happen. Doesn't happen often, but that's not a pyometra. So don't let them talk you into that.
Marty, we're at 1 hour and 10 minutes.
Okay,
So y'all need to say, but we're at 8:30. So how much more y'all got in you?
we can go. We can if you
All
you
night.
need to get up and go.
Okay, Marty does have to fly out at 7 o'clock tomorrow morning, y'all. What, Laura?
9 o'clock.
We're calling it at 9 o'clock,
Okay.
so you got 20
If
minutes.
anybody feels like they need to leave, please, you will not insult anybody. Just go. If you want to stay, I'm happy to keep going. Okay. What is the current state of in-house brucellosis testing?
Can't be done.
Can you go to your vet and get a brucellosis test? Where?
No, you can't.
You can if they're not using an FDA test. There is no current FDA test available in the United States for brucellosis testing. Should you brucellosis test?
Yes.
Yes. Is brucellosis still a problem?
Yes.
We're recommending using Cornell. This is their website for how to get a hold of them. The tests that you can buy online, and you can buy these, It tells you when you draw your blood sample, if you do these at home yourself, to put your blood sample on your ceiling fan and spin it.
No, it does
Inspire
not.
Confidence, it does.
Ha!
Does that inspire confidence in anyone?
No. 100% no.
So that's what it really says. So you can buy BioNote and you can run it yourself, but I don't recommend it because it's not an FDA-approved test. Zoetis pulled the test off the market about 1.5 years ago. I can't get an answer. I raised my hand at the Therio meeting because I'm on the board last February and said, I really think that the Theriogenology organization needs to put out a position statement on this. And they said, yes, we do. You're in charge. So we did. And then we had some people who weren't on the committee and who weren't at the meeting and who didn't give us their opinion. So we rewrote the statement. It'll be coming out again in the next week or two. But you will need to send your test in if you're going to get an FDA-approved test to a Cornell or one of your state diagnostic labs. There are 22 state labs that run the test. Some are running the BioNote, but we're assuming that they're probably running negative and positive controls, so we feel more safe about it. But you will not get a result back in 20 minutes like you're used to. You're going to have it sent out to a diagnostic lab so that you can get the turnaround. So be sure that you're planning far enough ahead for that. Okay, yes, question.
Have they done progress on brucellosis vaccination?
No.
Progress on vaccination for brucellosis, no.
What exactly is
Brucellosis
brucellosis?
Brucellosis is
a bacterial disease spread venereally and through any other body fluid, dog to dog and dog to human, that causes reproductive failure, discospondylitis, uveitis, and a lot of other diseases. When I was an undergrad, I worked at a human hospital lab drawing blood on human patients, and I had a patient that was a veterinarian with brucellosis. I got to see him spike a fever and draw his blood while he was spiking a fever, and I decided that day I never wanted brucellosis. Makes you really sick. It's called undulant fever. It's in your bone marrow for the rest of your life. You will never get rid of it. It's spread dog to dog, through urine, through placenta, through semen, through many body fluids, and people can get it too. You don't want it.
Okay.
Well, and I think the important thing, Marty, you could maybe touch on is some of what we're seeing with retail rescue, imports from overseas. Brucellosis has spiked.
Do you want me to really talk about this? We
I
can go down
do.
a rabbit hole.
Well, okay, just a small rabbit hole.
Okay, so we're going a little
Short,
bit down.
like a baby rabbit hole.
So it's bad. We are seeing dogs coming into the United States. We had 29 dogs that came into Wisconsin through Canada on legal papers, and 3 of those dogs had brucellosis. I had a client, I had my ultrasound radiologist text me a couple weeks ago that they had a client that had discospondylitis with brucellosis, a rescue dog. Brucellosis is out there in commercial kennels, it's out there in imports, it's out there in rescue. So if you are going to pick up a dog and help your breed club with rescue, don't bring it into your house and let it commingle with your other dogs. Get a brucellosis tested, quarantine it until you know for sure it's safe.
Brucellosis will wipe out your entire breeding kennel.
Forever. The state has the authority in most states to come in if you have a brucellosis positive dog or dogs. Come in, test your dogs every 30 days, and if at the end of 90 days they've had 3 tests that are positive, they can come in and euthanize everything at your house.
Oh.
So you can wipe out a 40-year breeding program in
This is what I wanted you to say, yes.
in one blink.
Small
You can be
rabbit
a
hole.
nice guy and say, sure, I'll help you with that rescue dog, and then you don't have a kennel anymore. So be careful. Just be aware that it's out there. Brucellosis has not been eradicated. We don't have a vaccine. We don't have a good test for it because it takes a week to get the results. It's difficult.
Is it the same as the one in cow?
No, it's still brucellosis, but there is a bovine form, there's a canine form, there's a sheep form, there's a goat form, but they all can cause zoonotic diseases.
And they don't. Someone had suggested in our area to ask the different species farmers to try to help stop these retail rescue situations. We were thinking that they would help support it, so there was no.
Right, it's not going to help. Okay, Eagle brand sweetened condensed milk comes in these cool bags or bottles from Walmart. What can you use it for? You can use it for those hypoglycemic puppies that aren't nursing well, or if you have those little tiny breeds like Yorkies that like to get hypoglycemic. You can use it to prevent constipation or to treat constipation in your puppies. it still comes in the can, but the can is really messy. You take the cap off, the lid off, you peel it off, and then you got this stickiness in your refrigerator. These bottles or bags come at, I've only seen them at Walmart. We also feel like it probably reduces stress levels in puppies at tail, dock, and dew claw removals. They did study in baby pigs that when they castrate them, that they know that they have less stress if their glucose level is high. So my staff gives Eagle brand sweetened condensed milk or Karo syrup to all of our puppies at the time that they're getting tails and dew claws done.
How much?
A little dab on the tongue. You can buy a glucometer for your dogs if you have problems with hypoglycemic puppies. They make a product called a pet test. It's the same basic glucometer that they use for people with diabetes, but you can buy them for dogs too. All right, plasma. I promised you plasma. Here it is. Plasma I consider to be magic fairy dust. I'm not sure why it does some of the things it does. We know it has antibodies in it. We know that we get better protection in our puppies for infectious diseases if they've been exposed to something or if they're sick or they were colostrum deprived. But there's something magical about plasma that if we have puppies that are sick, that they just really do well. Some people routinely give it at every C-section because they just really like how much stronger their puppies are. You can buy it yourself from hemopet.org. The dose is 16 cc's per puppy, and you can give it orally in the first 12 hours or subcutaneously at any age. So here's your dose. In small breed puppies, you need to divide it up because you can't give 16 cc's to a 2-ounce puppy all at one dose. But you can give it to bigger puppies.
And I have had my veterinarian draw blood from one of her dogs and spin it down for plasma in
Right.
major crisis situations where I ran out of my FFP I had in the freezer in a very bad situation. So if you have a vet you can work with on
But
that.
it's a lot of work.
I know.
You have to be careful that you don't get red blood cells in it. It's messy. And
You have to have a vet that knows what they're doing.
Mm-hmm. And if you have the plasma, you can purchase it in a bag. It's good for 5 years in your freezer. So as long as your family doesn't feel the need to defrost your freezer and throw stuff away, you're good. And again, if your veterinarian says this is something new, this article was published in 1992. Not new. So hemopet is probably your best place. If you do thaw it out, you need to use a warm water bath, not too warm, don't microwave it, and use a thermometer in the water bath so you don't overheat it. Plasma is the liquid part of blood.
Hemopet says you can refreeze it.
And we do.
Good enough.
Yes.
We give it routinely, even if they're not C-section. You don't know how much colostrum they're actually getting when they're nursing. So it's just a good thing to cover your bases.
Right, and many of my clients are very fond of it because they just feel like their puppies do better on it.
You just get it right when they're born?
Yeah. In the first 12 hours, you can give it with a feeding tube. After 12 hours, you have to give it sub-Q or...
Do you have to give it in a feeding tube? I thought you could give it just straight orally.
Well, if they'll take it.
Yeah.
A lot of puppies don't want to just take it from a bottle at that point because it doesn't taste like milk.
It's pretty salty, isn't it?
Yeah. So plasma is the liquid part of blood when you take out the red blood cells, the white blood cells, and the platelets. Dealy mucus trap. Does everybody know what a Dealy mucus trap is? No. Okay, Dealy mucus trap is this really cool device. It comes in a sterile package. I have some with me. They are really, really, really hard to get right now. They can you can't find them easily. And this is for resuscitating newborn puppies, whether they're born by C-section or vaginal birth. You use it to put in the puppy's mouth. One end goes in your mouth, like Heidi's got in her mouth. The other end goes in the puppy. And when you suck on it, just like a McDonald's straw, all the fluid comes out of the puppy and goes into this little chamber.
If you have a really weak stomach, I recommend you find a friend to do it for you.
You said you got these to sell, I would like.
Yes.
I do.
Yeah, they're amazing. You know,
And it's salty. It tastes salty, doesn't it?
Yeah.
Yeah.
It's like
I'm glad she said that.
Cool. I can't even listen to it. I have to
Okay, I feel like we're losing control here.
Can you say the name of that?
It's a
It's right here.
Dealy.
Right here.
It's a Dealy mucus trap.
Mucus?
Mucus.
Trap. Like, okay.
She's got ones you can buy.
They're $10. I would never whelp without one. I would never do a C-section without one. My staff enters the C-section room with a Dealy hanging out of their mouth. They greet their puppies like this. Here, I'm here to save your life.
Yeah.
So, it's pretty cool. They work really well. This is John, Dr. Strupp. He was John at the time, now he's Dr. Strupp, resuscitating a puppy with it.
There he goes.
Super easy. You can't screw up, can't use them wrong. They're $10. All you do is put it in the back of the throat, gently move it around. When you get stuff out, it comes out and it drops into the chamber, and then you don't have to swallow it yourself. All right, breathing. If you have puppies that are born and they're not breathing efficiently or strongly, I use 5-Hour Energy, the stuff in the little bottles, not the big drink bottles. Works really great. You put a couple drops on their tongue, and this will stimulate puppies to breathe. There's caffeine in it. You can buy it at any truck stop, gas station, or Walmart checkout. Tube feeding and bottle feeding. We don't recommend using makeup sponge feeding. Anybody have suggestions on why makeup sponge feeding seems like a bad idea?
Aspiration pneumonia?
Aspiration doesn't work. Chemicals, petroleum, they're made out of petroleum, fibers. Can you sterilize that sponge? How much did the puppy get to eat?
Don't know.
Don't know. How much air did they suck in instead of formula? Don't know. Very bad, don't do that. So if you are gonna feed a puppy, if a puppy needs to be supplemented, tube feeding is recommended unless they're strong enough to take a bottle. If they'll take a bottle, great. I'm more than happy to have you do that. I use the newbie, the Medi-Nursers. I have this little kit here that has a bulb syringe and the Medi-Nurser in it. They work great if you can get a hold of them. They used to sell them at Walmart for $1.88. They don't have them anymore. So it's a little harder to find. Puppies should gain 2 to 4 grams per day per kilogram of anticipated adult body weight. So if you're trying to figure out if your puppies are gaining adequately, you can do the math, use a calculator. Puppies, we used to say, could lose up to 10% of their body weight and they would be okay, but now we know from NeoCare's information, if they lose more than 4%, that they're not going to thrive, and puppies should double their birth weight in the first 7 to 10 days. So, if you have a question about it, you should supplement feed. Low birth weight puppies have an 81% greater chance of death in the first 48 hours, and large litters have an increased risk of death because they're littler, they're crowded in the uterus, there's just not as much chance. So in my world, no one should starve to death. If you looked at my husband, you would see that that's working for him.
Don't be dissing Dr. Dan, he's not here.
He's not.
It's not fair.
He's taking care of the other dogs. So no one should starve to death. There's lots of reasons we lose puppies. Starvation should never be one of them. So does anybody in the room feel like tube feeding makes them nervous? Okay. So we're going to talk about tube feeding so you feel comfortable with it by the time you leave today. You should not be using cow's milk unless you need it overnight until you can get real formula. You should be using a foster care or Esbalac of puppy formula because the goat's milk and cow's milk is not adequate nutrition for puppies. The foster care has IGY for intestinal immunity support, Biomos, which is a prebiotic, psyllium to give them formed stools but not to constipate them, and it has the amino acids that they need so that they don't develop nutritional cataracts. That's the reason that goat's milk and cow's milk should not be used, is they need those amino acids: arginine, lysine, methionine, and taurine. To tube feed, there's a couple steps to it. You want to make sure that you're feeding at 1 cc per 1 ounce of body weight. So if you have a 4-ounce puppy, how much formula do they need? 4 cc's. If an 8-ounce puppy, they need 8 cc's. Simple math, right? 2 o'clock in the morning, nobody needs complicated math. So have a warm, well-lit location. Hold the puppy, don't let it fall on the floor. And people do that. Don't rush. And then you want to make sure that you do the 5 P's. So you pre-measure the tube from the tip of the nose to the last rib so that you know you're in the stomach and not in the airway. So you measure from the last rib to the tip of the nose. You want to pass with the chin down to the left, pre-warm the puppy in the formula. The puppy needs to be at least 96 degrees Fahrenheit rectally. And if you feed after you pinch the tail or the toes and they can cry, you know you're in the right spot. Yes.
All right, okay. So you just made a comment about they need to be 60 or 96 degrees.
Right.
What about why do they need to be 90? Well, of course, a lower temperature, but what's going to happen if you feed a puppy that is
cold,
below that temperature or
right?
Below that?
If you feed them before they're warm enough, then the food doesn't digest. They develop ileus in their intestinal tract. The food sits in their stomach, foams up, and then they aspirate and they die.
Okay. So, and then, okay, my second question is, so what if you're dealing with a very weak puppy. I actually just had this happen. Some friends called me. They had puppies C-section Tuesday morning, and they called me 6:30 Wednesday morning, frantic because 3 of them are faded. Come to find out, those 3 hadn't eaten since the glucose that was given to them when they were delivered, and they didn't know how to tube feed, so I rushed down 3 of them. We lost 1, but with him, so it was a Newfoundland pup, and I had to weigh him, but I only gave him 3 cc's to start because since he hadn't eaten anything, I didn't want to
Over distend his stomach, yeah.
Okay, so was that the right thing to do? That
Yeah.
I ended up, we lost the 1, but I was able to save the 2.
Good.
So they were also given plasma.
Mhm.
Sorry, I could go off on a whole thing because there's another puppy that's got some weird things going on that has streptococcus in his feet.
Mhm.
And so I got him into the vet because the one pup that died, everything started turning purple. It was a really weird situation.
That's
So
sepsis. Yeah.
Well, and that's what I thought too, but
Almost
his
there.
skin was tenting, I pinched him, and it's super dehydrated, so I went to get Pedialyte because there wasn't any fluid that I could do subcutaneous. It's
Right.
a shit show. Or, sorry for
Yeah, whatever, it was a shit show.
And so, anyway, I come back, he had been put on top of a heating pad and wrapped in a washcloth,
Now
and
he
was
was
like
too
getting
hot.
cooked. Yeah, he was getting cooked.
Yeah.
So I put him under my shirt, and I was going to load up the syringe with Pedialyte to get some fluid in it. And when I set him down on the bed, he went completely rigid, purple, and passed.
Yeah.
And there was it starts with a D, and I always say it wrong, but you can do a couple drops into the tongue to try and snap him back. Do you know what I'm talking about?
Probably dextrose, but I never use that.
Yeah. Well, and it didn't bring him back. And so he was confident. There was the other pup. So as soon as I saw him purpling, I saw, I went and checked all the other pups. Because I was like, I didn't know what was going on. I saw the other one with the paws.
Right.
And anyway, so the pup has, well, I won't.
Yeah.
I can go on about it.
So you need to
Let's
be
keep
warm.
moving.
Yeah, you need to be warm. So measure the tube from the tip of the nose to the last rib, and then when you feed, you want to feed slowly, and you want to make sure the puppy is crying when you're doing it. So for these 2 guys, this was a Rottweiler litter. There were 2 boys in the litter. She came in on a weekend because she was concerned that the one puppy wasn't thriving. There is no diagnosis fading puppy. That's a description, not a diagnosis. So there are lots of reasons puppies don't thrive, but that's not a diagnosis. So this client identified that this puppy wasn't gaining, wasn't doing what he should be, wasn't keeping up with his brother, so we taught her how to tube feed. I made her do the tube feeding because I know how, and she didn't. So we did that, and I'm going to ask you if you could tell which of the 2 puppies this guy was when he was at 7 weeks old. Can you tell? Nope, you can't, but you can tell who he is now, right? He won Best Puppy in Match when he was 9 months old. So a runt puppy, a puppy that fails to thrive, should not be considered to be a puppy that you just throw away. He has potential. No one should starve to death. So fill the syringe, put the syringe on the tube, and then go ahead and feed. And I do have feeding tubes with me if anybody wants to pick up a feeding tube because it's a little scary, but it's not terribly difficult. The main thing is that you pinch before you feed so that you make sure you're in the esophagus and not the trachea. You have a question?
So how do you decide when you can quit feeding?
You're never going to do anything wrong by tube feeding. A puppy that's fed by tube feeding or bottle feeding is not going to suppress their interest in nursing. You can put a puppy down and right after you tube feed and they crawl right over and start nursing again. Who goes to Thanksgiving dinner this week? Who stops eating after they're full? And then who gets up and has a piece of pie and ice cream, right? Okay.
More mashed potatoes.
Or more mashed. Yeah, whatever it happens to be. Having a full stomach doesn't keep the puppies from nursing. So you want to just make sure that you tube feed. There's, like I said, the Medi Nurser works really well if you can get it. The Esbalac kit is a disaster. I've gone up to them at the booth multiple times and said, your nipples suck, and I don't mean that in a good way. I've never had success with those, but I like the Miracle Nipple. I like the Medi Nurser. There's some good bottles on the market. Puppy Warmer is developing a silicone nipple. Karen Kusick has a cleft palate nipple. It's got a shield on it that covers up the cleft palate if you have a cleft palate puppy. You have to buy those online. You can't get them anywhere else. And if you Google search amazing nipple, make sure that you put in the word dog. Because it's unfortunate what comes up on your computer search. And then you'll probably have some things coming in your email that you don't need for. So, she's on Facebook. She's got a website, so she's got some great nipples for you. Agalactia. Agalactia is the failure of a female to lactate. It is not some kind of an agalactical creature. There's a few tricks to getting bitches to nurse. Oxymama is one of the revival products that has fenugreek in it that really helps. Reglan and oxytocin are both prescription items you can get from your vet. Reglan is metoclopramide. It is a prescription product. It brings in the milk. Oxytocin is a prescription injectable. It lets down the milk. So those two things act in different ways, but they're both very effective. The other things that work well are bratwurst. I don't know why bratwurst work, but they work.
From Wisconsin, you would know that.
I know, because I had a Newfoundland
And
that
beer.
taught me this one day.
Don't forget the beer.
And the beer. So boil them in beer. I had a client that came in and she said, bratwurst will make your bitches lactate. So I had a bitch at that time, a corgi bitch that wasn't good at producing milk, and I said to my dear husband, you need to run to the locker plant and pick up some brats. And he goes, oh, good. I said, honey, they're not for you. So bratwurst will bring in the milk. I don't know why there's no fenugreek in those. I know what goes in them. Root vegetables and oatmeal are what human lactation nurses work with to help in bringing the milk. Warm compresses, getting the bitch to drink, getting your starter mousse mixed in with a bucket of water, and then fluids if she needs them. So those are my little formulas for getting a bitch to improve her lactation. Medicating puppies. This is always fun. How do you get medications into your dogs? We use, you can buy string cheese or cream cheese in a can now, not just regular cheese. You can get that. Ready Whip, the whipped cream works really well. This is marshmallow fluff. This is what we use at the practice. So peanut butter is not the only thing that you can do to get puppies to get their medications. And then I figured out this week, kind of embarrassed it took me this long, for 89 cents at the dollar store, you can buy these nice little cans of sausage.
Yep.
These are really nice to travel with when you go into a dog show and you're flying. Threw that in my suitcase. I don't know why it was 89 cents. It was $1.25 at the store. It was supposed to be. And then car sickness, Serenia is a great drug if you have dogs with car sickness. Their ad campaign was Ralph, the green dog. But I use a lot of ginger snaps too. Isn't that funny? They named him Ralph. Quite clever. Ginger snaps, I use a lot of ginger snaps in the practice. Dogs really like those, so those are fun things to do. I want to just mention briefly National Animal Interest Alliance. I want to make sure that you all know that Patty Strand is here in Portland and does an amazing job helping us keep our dogs and our dog laws under control. So remember, she's got the Healthy Dog Importation Act that she's working on. Maternal bonding, I send home placental fluid with all my C-sections so that we can put that on the puppies when they go home, that they don't smell like laundry soap. The other things that work are calcium that comes in the tube and the Thunderies or the Adapto Colors. That's my bitch chewing on a tube of Oral Cal Plus. It tastes pretty good. She pulled that out of the garbage. Don't forget, water is the most important nutrient that our dogs need. It's not just food. So there's many ways to get water into our dogs. I love the Lixit bottles. This is the QR code for Revival Animal Health. If you're looking for our learning center, we have lots of webinars, lots of videos, and lots of articles on there. Puppy survival rates, we know that bitches that have C-sections have a 5 to 6% higher puppy survival rate if puppies are born by C-section than if they're born by vaginal birth. And then we've got a bunch of photos, but I'm not sure we're going to have time.
I think we're